Hello everyone, my name is Jahaira, and for this web report I will be talking about the website by Johns Hopkins Medicine. When you go into this website, there is a search bar right on top, and you are able to put in any type of disease you would like and learn more about it. I went ahead for this web report and put in endometriosis. Endometriosis is a disease that is an abnormal condition of the endometrium. This type of disease, we learned about it in chapter 8 in the female reproductive system. And this article, once I went in, got into the website, Johns Hopkins Medicine explains in full detail everything you need to know about this disease. It gives information about the causes, where it can occur, where it can occur, the symptoms, how to diagnose it, and the treatments that they recommend, or the doctors recommend. In this website, I was able to find 5 medical terms that I recall learning in class, which was endometrium, uterus, gynecologist, laparoscopy, and hysterectomy. So endometriosis is a word built from word parts, endometri being the word root that means endometrium, and osis is being the suffix that means abnormal condition. According to this website, I also was able to look that it affects an estimated of 2 out of 10% of women in the United States between the ages of 25 and 40. The next one was endometrium, which is a word not built from word parts, that is part of the female reproductive system, that is the inner lining of the uterus. As it explains on the website, women with endometriosis develops tissue that looks and acts like endometrial tissue outside of the uterus. The uterus is a word not built from word parts, that is a muscular organ in the female reproductive system that lies in the pelvic cavity. Its functions are menstruation, pregnancy, and labor. The cause of this condition is unknown. There are some theories out there that they put out. They put a theory in the website. It explains that they suggest that maybe the cause of this is that during menstruation, some of the tissue that is supposed to be released gets backed up through the fallopian tubes in the abdomen. They call this reverse menstruation. The most main symptoms are pain, excessive menstrual cramps, pain during intercourse, abnormal or heavy blood flow, menstrual blood flow, infertility, and other gastrointestinal problems. To get diagnosed, one goes to a gynecologist. Gynecologist is a word built from word parts. Gyneco being the combining form that means woman or female reproductive system, and logist being the suffix that means one who studies and treats. The physician evaluates the patient by their medical history, a physical exam, and a pelvic exam. And then to be certain, the physician performs a laparoscopy. Is a diagnostic term built from word parts. Laparo being the combining form that means abdomen, and scopy being the suffix that means visual examination. By using this procedure, a tin tube with the camera is inserted into the abdomen. Then that will help locate the location, the size, and the extent of the endometrial growth. It also explains on the website that there's 4 stages of endometriosis. There's minimal, mild, moderate, and severe. There also explains that someone with a moderate could have more pain than someone that has severe. Someone that's severe could have like no symptoms, but could just be having heavy menstrual periods or abnormal periods. So it all depends on the person. After being diagnosed, there are some treatments and options that the website explains. Some treatments could be pain medication, hormone therapy, oral contraceptives. If it gets progresses to get worse. A laparotomy, that's a procedure that removes endometrial tissue without damaging healthy tissues. That could be a helpful option, and the one they usually leave to the end if it worsens is a hysterectomy, which is a surgical procedure built from word parts. Hyster being the word root that means uterus, and ectomy being a suffix that means excision, surgical removal. So by this, doing the hysterectomy, they remove the uterus. Yeah, so my question to my classmates is, can you describe and share another website related to endometriosis, and what are their theories about the cause of this condition?